Hi, thank you for checking out this video on everything you ever wanted to know about bulging versus herniated discs, but were afraid to ask. I'm Dr. Kevin Smith. I'm a doctor of chiropractic. I'm the author of the book Modern Chiropractic, The Way to a Pain-Free Lifestyle. I'm a speaker, writer, and clinician, and I've been in practice since 2001. I'd like to welcome you to this video. Disc problems are very common. They affect millions of people every year, and billions of dollars are spent annually on medications, therapies, and surgery. If we take a look at the disc here, the disc anatomy, it has two parts. It's got an inner part called the nucleus pulposus and an outer part called the annulus fibrosus. If you take a look at this illustration here, the nucleus is in the center and the outer part is called the annulus, and it kind of looks like rings of a tree or the rings of an onion. The annulus fibrosus is very tough, cartilaginous material. It's basically cartilage. And the nucleus pulposus is very soft and pulpy, like the center of a jelly donut. The disc is located very closely to the spinal cord and the spinal nerve roots. If you take a look at this illustration here, here is the disc itself, and here is the spinal cord and the spinal nerve roots. The discs have nerves, and they are a common root cause of spinal pain. The discs are located between the vertebrae. They are known also as intervertebral discs, and they function as a shock absorber. They separate the vertebrae. Here's a picture of the spinal motor unit in a spinal column. Here you have a vertebrae separated by a disc, then a vertebrae, then a disc, on and on, up and down the column. The normal configuration of a disc is to be centered in the vertebrae, right in the middle. If the disc pushes back towards the cord, it is bulging. So in this case right here, you have the disc, and it is kind of pushing back towards the spinal cord and the spinal nerve root, and that is bulging. That is what a bulging disc looks like. The thing about a bulging disc is that everybody has one, and most of the time they're clinically insignificant. The discs are mostly composed out of water, and they behave like a water balloon. If you've ever played around with a water balloon and you push down on one side of the balloon, it kind of pushes out and bulges on the opposite side of wherever you're pushing. So if I was to push down on this side, the balloon would push out on that direction. And if I was to push down on this side, the balloon would go in that direction. The same thing happens with a disc. If you push down on one side, it'll bulge out that way, and if you push down on this side, it'll bulge out that way. A herniated disc is a different thing, however. A herniated disc is a much more serious condition, and they can cause significantly more pain. With a herniated disc, the outer part of the disc, the annulus fibrosus, is damaged. The inner part, the nucleus pulposus, then starts to ooze out, typically in a diagonal direction towards the nerve root. I've often heard people talk about a slipped disc. This is just an FYI moment. There is no such thing as a slipped disc. Discs don't slip. Now, a ruptured disc is basically the same thing as a herniated disc. Disc herniation diagnosis typically involves three variables: the location of the problem, the magnitude or the extent of the damage, and the direction of the hernia. Most of the time, the discs are going to herniate in one of two directions. The one is, if you take a look at this illustration on the left, you have the nucleus in the middle and the annulus on the outer part, and the hernia is going in a diagonal direction. That's called a posterolateral hernia. And in this direction over here, on this side, we have the nucleus and the outer part, the annulus, and the hernia is going straight back. That's called a central hernia. There are certain movements that can actually aggravate a hernia, a herniated disc, and the one that's the most common is flexion. Flexion is when you bring your head or your low back in a forward movement, and in this particular case, you see this gentleman bringing his head with his chin down towards his chest. This movement this way is called flexion. And if you take a look at the x-ray view here, this is what it looks like on x-ray. Again, if you when you bring the head forward, you're compressing the discs in the front here, so that's pushing the content towards the back. This is where the spinal cord is and the spinal nerve roots. So when you bring the head towards flexion, everything gets pushed back, and that can aggravate your neck and make you create a lot of pain. The opposite of flexion is extension, and with extension you bring the head back so you're looking up towards the sky. This x-ray view shows extension, and what's going on here is that as you start getting a little bit of compression in the back part of the vertebral bodies, the contents of the disc push away from the spinal cord and the spinal nerve roots in a forward direction, and that will provide a lot of relief a lot of times. The diagnosis of disc problems involves getting a good history, followed by a proper examination, and then an imaging study. With disc problems, the imaging study of choice is an MRI. Medical treatment for disc problems usually involves medicine followed by surgery. Medical treatment is risky and invasive, and it has a high probability of failure, according to the research, greater than 50%. The physical medicine approach includes chiropractic care, physical rehabilitation, and this has excellent outcomes. It's also a lot less risky, a lot less invasive, and it just works great. I'm the developer of Mass Correction. Mass Correction, Mass is an acronym that stands for motion, alignment, and strength. I restore motion to the nerves, to the joints and the muscles. I restore alignment to the skeletal system to take the pressure off the nerves, and then we strengthen the spine to provide permanent relief from chronic pain. This is excellent for disc problems, and it is the new gold standard in physical medicine. I have a free ebook titled The 7 Critical Things That You Absolutely Must Do to Beat Chronic Pain. To get access to this free ebook, please visit me online at www.redapplewellness.net. Thank you very much for checking out this video.